Welcome back. A year into the pandemic, more and more people are faced with mental health stressors, and they need behavioral health support. A program at Montefiore here in the Bronx recently earned a national distinction for behavioral health for their continued work in addressing the mental struggles people face with life stressors, grief, and more. Joining us now to discuss is Dr. Jason Herrick, Interim Director of the Adult Behavioral Health Integration Program at Montefiore Medical Group. Welcome, Doctor. Thank you so much for joining us today.
Thank you for having me.
Of course. To start, can you please tell us about Montefiore's Adult Behavioral Health Integration Program, or BHIP?
So simply the BHIP service is a network of mental health clinicians that are embedded in Montefiore Medical Group's primary care practices. The teams that are in each of the sites are meant to provide mental health treatment in the primary care setting, and the reason is that provides timely access to care that we all know nationally and certainly in the Bronx is in short supply. And the fact that we are treating both physical and mental health problems in tandem, this is also a good thing because the data has shown that there's better outcomes on both fronts, both with the medical conditions as well as with the mental health conditions. And that just additionally highlights how the medical group is working to approach total wellness of our patient population. The program really does a great job of destigmatizing mental health. You're going to your primary care doctor to get treatment for medical and health conditions, and it sort of brings in the mental health component to that. And it really focuses on addressing the total wellness of our patient population and the communities that we serve.
Wonderful. Thank you so much, Dr. Herrick. And what exactly is integrated behavioral health? And how has BHIP continued to provide resources and services to Bronx families, especially during this pandemic?
There's a lot of different types of integrated programs. Integrated behavioral health is like I said, it's a network of mental health clinicians that are embedded within the clinics that share medical records, that have meetings and interact with the medical providers at our primary care sites on a daily basis. So it's a way that we can, share the responsibilities of treating the patients in our communities that need our services. And mobilize that relationship that primary care doctors tend to have with their patients, which is a strong, long, ongoing, sometimes even lifelong relationship that they have. What we do is we accept referrals from PCPs, from primary care physicians who have been identified who have identified at-risk patients. These are identified in a variety of ways. There's a variety of universal screening protocols that we have, which will screen for depression, anxiety, substance use. They will screen for ACEs, which is a scale for adverse childhood experiences, which has been shown to when you have more of those, you have a higher risk for medical and mental health conditions. A patient can also come in and just request help and ask to be seen by one of our team members. Or there's clinical impression that the medical provider or anyone in the clinic may have. It could be a nurse, it could be a front desk staff that says, oh, maybe you might want to talk to someone on our team that is here in the site. As you mentioned or referred to, COVID-19 has certainly required us, like everyone else in the community and really the world, to change the way that we do what we do. Historically, we did a lot of face-to-face work, a lot of the sort of what we call the warm handoff, where our PCP would identify an issue and then walk to our office with the patient, or would come find us, and then we'd go to the patient to the exam room and introduce ourselves. And there's a lot of data that shows that increases engagement, and they're more likely to come to the visits and follow up with the mental health intervention. Obviously, we've had to modify that. And because for social distancing purposes and to ensure the safety of our team as well as the patients that we're serving. And the way that we've done that is the medical group and our team has implemented telemedicine services that allowed us to really disrupt the care. Certainly, in the beginning there was some difficulties, but we were able to sort of limit disruptions of care as we kind of went through that initial surge last spring. The connecting with patients remotely, certainly there was a learning curve, and a lot of our clinicians had to retrain ourselves to deliver the services that we are really skilled at delivering in a different modality, kind of losing a sense, so to speak. You're not in the room with them. And our ability to connect with them remotely did serve that acute need during the initial surge, and later when there was a second surge and a second wave. We've also seen during that period of time that the remote service has been associated with improved show rates. So our patients are actually coming to and keeping more appointments. And I think We believe that, that this is really amenable to the patients that we support. There's a lot of barriers that are in place that makes follow-up, particularly for mental health services, challenging. So while there's still certainly some barriers that we need to address, and those things we've probably heard about, access to a reliable broadband, familiar with technological platforms. Right. For some, we do see it as sort of the future of how we're going to ensure the optimal mental health care to our community moving forward, which really is good to be able to think about and to see how we can take this negative experience and move forward with it in a positive way that can address the needs of our patients in a more timely and effective way and more patient-friendly way as well.
Thank you for that, Doctor. And speaking of the pandemic and, future research or future developments when it comes to the COVID-19 pandemic, early research by McKinsey and Company predicts that nearly 35 million people nationwide will develop a new behavioral health condition. What are some of the contributing factors to this rise?
Clearly, it's multifactorial, but there are certainly common themes that would contribute to the rise in mental health conditions that we're seeing. If you kind of put them into various baskets, there's the fact that people have been isolated, and isolation is certainly difficult for a lot of people. We are, humans are social beings at nature. A vast majority of us are. And to not be able to connect with people or interact with people in the way that we typically are accustomed to, whether it's friends or family members, that certainly contributes to a level of withdrawal and depression. We've had a sustained change in our routines, and to some extent we are creatures of habit. We do things in a sort of habitual sort of way, and when we have change in our routines and we don't really know when we're going to get back to our previous routine, or are we ever going to get back to our previous routine, you do see an increase in that unknown. And if you think about conditions such as anxiety, a large umbrella of a variety of conditions, a part of what's predicated on that is I don't know what's going to happen. I can't predict what's going to happen. When we have some of our routines historically, we have some sense of, we could anticipate what the future may hold with a greater level of confidence than we certainly do now. Obviously, we've never been able to predict the future, but it's certainly more difficult to do over the past year. It's been very much discussed in the media and certainly amongst the groups of people, but the pandemic itself has exacerbated a lot of psychosocial stressors. So, people losing jobs, people, losing loved ones, people not being able to, losing their housing. So those types of psychosocial stressors are things that certainly contribute to increase in mental health conditions. And, I would also add that we've seen an increase, and this is also something that's been talked about and discussed widely, is that we've resorted, as a population, we've resorted to a fair number of maladaptive coping mechanisms, such as substance use, whether it's increase in marijuana use, increase in tobacco use, increase in alcohol use. And those things may in the short term feel like it is allowing you to escape and cope and sort of and manage the pandemic and some of the thoughts and feelings that you've been having during the various quarantine situations or other sorts of stressors that have been going on. What people don't always realize is that substance use can contribute to mental illness, even though initially it might be seen as a coping mechanism, which is why we call it a maladaptive coping mechanism. And then I did mention grief a minute ago in terms of things that we've experienced. Grief can be thought of as on a personal level, like the grieving for the loss of loved ones, and Americans have lost more loved ones during the COVID pandemic than they have during a majority of the wars that we've been involved in combined. But it's also the grief for a loss of who we were as a people, who we were as a community. Things like going to a concert or going to a baseball game, or for kids going to school. I joke around with my kids that a silver lining is to be my kids really want to go to school now. But there's this loss, just being able to connect with people. And so it's beyond just, I think, the physical loss. It's just a loss of what was. And I think that that's also something that certainly contributes to an increase in the mental health conditions that are being predicted.
Absolutely. Thank you for breaking that down, doctor. And I feel like we all collectively feel some sort of, disrupt, of course, with the pandemic. And maybe some of us are also not diagnosing or treating those conditions. Can you also talk about, if somebody's watching right now, if there's someone they know is depressed or anxious, what are some of the symptoms that they should look out for?
I mean, there's certainly there's the diagnostic symptoms that you could look out for, but no one's expecting any person to be a clinician themselves to make these diagnoses. I think what you want to be looking for is like a change. And there you see the signs of the depression right there. Is that you want to be looking for a change in sort of what their baseline behavior was. And if you think of like one of the hallmarks signs of someone who has depression is like withdrawal. And it's withdrawal from a lot of things. It could be withdrawal from activities that they previously enjoyed that they just don't have that level of enjoyment. We call that anhedonia, and they just stop participating in them. They don't have that drive or passion to engage in those activities. But if you think of it as just like a general withdrawal from life to some extent, they're the people that are having a hard time getting out of bed or want to just sort of stay by themselves, and they socially isolate themselves even when they don't necessarily need to for quarantine purposes. Avoidance, when people start avoiding certain things, again, it could be activities that they typically enjoyed. It could be doing things that are considered relatively safe now, but they're still avoiding doing certain activities. That could be an indicator that there's a level of anxiety. And avoidance is the hallmark of anxiety, and it is strongly reinforced when we avoid doing something that causes us to feel anxious. We feel, oh, that feels much better, so I don't do that anymore. So that might be indicative of some problem as well. I did sort of allude to substance use. So substance use is commonly thought of as a coping mechanism for perhaps self-medicating of mental health conditions or other conditions as well. So that should also be something that could be considered a red flag. But if you notice a loved one or someone who is drinking more or using other substances with more frequency, that might be something, an indicator that there's something going on and that there might be time to seek help. Ultimately, we want people to know, in one of our program of access to care, is we want people to know that they should seek help, and there is help that is available to them. What we see all too often is people wait to the last minute to seek help, and one of the benefits of being in a primary care center and having these services delivered there is that primary care is a preventative specialty. So we want to sort of bring and have the mental health clinicians in a primary care setting where you don't need to wait. If you or a loved one is having any issues, ask your doctors about feeling sad, worried, or whatever it is that might be going on. And the team of doctors, PCPs at the Montefiore Medical Group are certainly trained and skilled, and we have screening protocols that will help identify these problems and then be able to offer you the care the care that you need. And if we can't offer that care, we can hold your hand or bridge you until we get you hooked into the services that we think would be best suited for you.
Thank you so much, Dr. Herrick, for your time today. I wish we had more time, but we've learned so much with you in this segment. So thank you again. Before we go, how can people find out about Montefiore's behavioral health integration program?
The best way to probably get to learn about the program itself would be go to the website, the Montefiore Medical Group website, which is www.montefiore.org /BHIP. And the medical group is the same, www.montefiore.org /MMG. You can also find us on Twitter, Instagram, and Facebook. And as we do certain things, we certainly post and update the social media. That seems to be where more people get their information these days, increasingly so. So anything that we're doing, whether there's certain programs or groups or anything like that, those are places where you could find those things coming up.
And we welcome you back here on Open Tuesday, Dr. Herrick. Thank you so much. Whenever you want to come back.
All right. It's great to meet you. Thank you.
Nice to meet you as well. Dr. Jason Herrick is the Interim Director of the Adult Behavioral Health Integration Program at Montefiore Medical Group. Open Tuesday will be right back.